Simutenge mwana wewe baba kala jalepuka kamfungira mbyangon here uzemtenga kwemori ya kuza lolao akulepuka ni atuma ishadimao masikihe irika mkongo wapate dawa kale msimae kongo wakulepuka vilalwe kagonya ugundu wa vinamuaswe.
Difu Simo is a Giriama word meaning breaking free, chosen as the project's mental health awareness campaign title. The project is a collaboration between the Kenya Medical Research Institute, Malindi District Cultural Organization, Documentary Institute of Eastern Africa, and the county government of Kilifi. Difu Simo has been a massive production involving approximately 70 artists. Among these are dancers, musicians, singers, poets, technicians, volunteers, biomedical personnel, and individuals representing several institutions. Difu Simo aims to bring together the world of science, arts, and the local communities, fostering constructive discussions to reduce stigma towards people living with mental illnesses in Kilifi County.
Jambo. Good afternoon. Nimefurahi sana kufika Kede. Ni mara ya kwanza na mimi ni mhudumu wa afya katika hospitali ya Portris Mental, na leo nimealikwa hapa ili niweze kuungana na watu wa Gede. Tuwatunze, tuwalishe, tuwapishe, tuwapende, tuwatunze, tuwalishe, tena tuwapishe, tuwapelekeni hospitali kunayo tiba tofauti kulingana na matatizo ya kimila.
Biomedical specialists and traditional healers met with people with lived experiences of mental illness, their families and communities, engaging them in dialogue to reduce the stigma and provide instructions and guidance to seek assistance at the local healthcare facilities. The artists collaborated with the researchers to craft special content which included specific mental health messages to be delivered to the public in the local Giriama language. Difu Simo Awareness Tour was conceived as an event combining a music tour with the Baraza, a typical public meeting model of Kenya.
Kiburi, kimtuma, simjeuri, watu mitani walimuita mtoto wa Mungu.
The event gathered an overall estimated attendance of approximately 2,000 people while ensuring optimum adherence to safety guidelines. The friendly environment generated social cohesion and trust between the organizers and the public. The precise burden of mental illnesses in Kilifi County is unknown. However, data on indicators of severe mental illness, such as annual rates of suicide in Kilifi, suggest that the prevalence of common mental disorders such as depression is high, although many cases are undiagnosed and untreated. With a population of over 1.2 million people, Kilifi has only 2 psychiatric outpatient clinics, which are run by 3 mental health specialists. These clinics serve over 5,000 patients annually. The number of patients who are managed by traditional health practitioners and faith healers is unknown.
When we started,
It was a nice journey, and we had so many people. And after I gave out the talk about mental illnesses, and they were able to confess that there are people who are indoors, they've been locked in for several years because they didn't know where they could help these people. People were like, where can we get these services? Because they didn't even know that Kilifi can offer the mental illness treatment. But because of this campaign, now they know that Kilifi Hospital offer these services for people who have mental problems. Also, they were asking about how our people can be helped because of the low socioeconomic status of the village. It has made them not to seek further medications, but we were able to tell them how protocols, how they can reach the hospital and be helped, whether they will have the money, but the government can sort them out in terms of churches. They were like satisfied, and they are ready to bring those people who have been in captives for so many years with mental illnesses.
The media coverage was considerable at the local, national, and international level. Kilifi mental health hospitals registered an exponential increase of patients seeking assistance in the weeks following the awareness walk. The team has also continued to receive phone calls from the public seeking guidance on available healthcare options for mental illness. The Difu Simo campaign has been the first leg of a long walk that must continue to engage and sensitize Kenya and Sub-Saharan Africa's communities on mental health matters.